If your doctor sends you for blood work, you go and get that blood work done, and the lab sends you your results, but you see some abnormalities. Please, guys, don't necessarily freak out. That's right. Please don't freak out. Make sure you have a chance to talk with your doctor first. Let me explain, okay? Now, first of all, as a practicing family physician, I've been in practice for, 13 or so years, and labs did not used to send patients their lab results. It used to be the doctor that used to get them only. Well, nowadays, LabCorp, Quest, and other labs are sending you all, and myself, I'm a patient too, they're sending us our results. And by the way, I'm a fan of it. I mean, I recently got labs done for my doctor, and the next day, I had the results in my inbox. I was actually kind of surprised. But the only thing about that as a doctor I see can sometimes be problematic is you might get that lab work in your inbox. You may say, oh my gosh, what's going on? You may open it up, look at it, and see lots of H's and L's, or a few H's and L's, or maybe one or two. But whatever the case, and H, by the way, means high for whatever number it's next to. L means low. You may look at that and say, oh my gosh, there's something wrong. My labs aren't perfect. There's highs and lows. Neutrophils are high. BUN is low. This is high. That's low. Oh my gosh, what's going on? And I needed to make a video about this because I've had a number of patients more recently be worried. Spend weekends really, really concerned or worried, or days and nights losing sleep over what they were seeing with their labs. Now, the truth of the matter is, when I recently got my labs back from LabCorp, I got my labs done. I opened them with bated breath. I was so excited to see them, and I completely get it. I mean, I read the labs like nobody's business, just like anybody else would. But I also realized that if I didn't have the context or sort of the knowledge or experience to sort of put those labs in context, it could have really, really worried me. And I've seen a lot of patients recently in the office that have gotten their labs back, but they're not able to see me for a week or so more, and they Google schmoogle their labs. I get it. The Googler schmoogler is not always the best when it comes to our lab results, but I get the idea of wanting to know, what does it mean if neutrophils are high, or eosinophils are low, or lymphocytes are high? I get it. The problem, though, is that what you read online may not apply to you. It may not be accurate for you. It may not be the context that you need for your situation. And as a result, it can cause a lot of people to be worried or scared. Now, this is the thing. I'm not advocating for labs not sending patients their labs. This is kind of where we're going. And you know what? I'm a fan of it. I do believe in patient empowerment. I believe you should sort of be in the driver's seat of your healthcare. But this video is to remind you that when you get your blood work back and you see some abnormalities, don't automatically assume that those abnormalities are a major problem. You never know. It might be that your labs are actually better than what they were in the past or last time. It might be that given the medical condition you have, these labs are appropriate. There's a million other scenarios that might apply. The idea is when you get your labs back and you see abnormalities, don't assume the abnormalities mean something is wrong. Now, I'm not your doctor, so I can't say that your labs mean that everything is right. What I'm saying is allow your doctor to go over them with you, to put things into context, in perspective, so you understand what they mean. And also understand that interpreting one lab, one off here and there, whether you're Googling and trying to figure out what's going on, etc., may not be the appropriate context or an appropriate representation of what's actually going on with you. This is all to say, I don't want you to worry and lose sleep and stay up night after night, or have a bad weekend because you get your lab work back. And there are things that you can't reconcile. Allow your doctor to help you do that. Talk to your doctor. If you're worried about something, give us a call. Send us a message over our portal. Ask us. Even if it's before we're supposed to see you to go over these things. If you think there's something concerning or worrisome, you should be doing the same thing. But the idea is don't assume that there's anything necessarily wrong. I hope this is helpful. This is just a snapshot of things. Again, I love it when patients are empowered and you're able to be at the forefront of your healthcare. But also understand that there's some context that you may not fully grasp that may actually help put some of the labs you get into better context. Guys, I'm Dr. Jen Caudle. I hope this is helpful. Let me know if you've ever been freaked out by lab results that you've gotten from your doctor or someone else. Please subscribe to my channel. Click the little bell for updates. Guys, I'm Dr. Jen. I'll see you soon.